Welcome to The Explainer. Today, we're diving into a public health crisis that's been growing, often out of sight, and we're going to look at a really innovative way researchers are trying to tackle it by combining cold, hard data with a human heart. Okay, so here's what we're going to cover. First, we need to get a handle on just how big the meth crisis has become. Then we'll look at why the usual ways of tracking this stuff just aren't cutting it. And from there, we'll zero in on this incredible study from Manitoba that might just change the game by giving data a human voice. All right, let's start with the hard numbers. I mean, to really get why this study was so important, you have to understand the sheer scale of the crisis, especially how hard it hit Canada's western provinces. Check this out. Between 2010 and 2015, hospitalizations for stimulant use in Manitoba, they didn't just go up. They skyrocketed by a staggering 600%. And, we saw similar massive spikes in Alberta and British Columbia. This isn't just a small trend. It's the siren of a full-blown health emergency. And this is where things get really tricky. There was this huge gap between what the big national surveys were saying and what was actually happening on the ground. So while the official data suggested pretty low meth use overall, the reality in the emergency rooms was telling a completely different and way more alarming story. So that brings us to a really important question. If this problem is blowing up so fast, why is it so ridiculously hard to study it effectively? Well, it turns out that traditional national surveys, they cast a really wide net, but the holes in that net are just too big. They tend to miss the very people who are most affected, folks who might be homeless or unstably housed. They also kind of smooth out all the data, which hides those dramatic regional spikes we just talked about. They just don't capture the full, complex picture. So to try and get a clearer picture, researchers in Manitoba decided to try something totally different. They decided to tap into the power of population-wide data. They use this thing called linked administrative data. Honestly, the best way to think about it is like they're putting together millions of anonymous puzzle pieces from the province's entire health story. By linking all these little pieces together for each person, while keeping everything anonymous, of course, they can suddenly see these huge patterns and trends you'd otherwise completely miss. And just look at how deep they went. This wasn't just about one little piece of the puzzle. They linked data from hospitals, ER visits, paramedic calls, pharmacy records, and even the justice system. By connecting all those dots for every single individual, they were able to build this incredibly rich 360-degree view of a person's journey through all of these different systems. But just having a mountain of data wasn't enough. The most innovative part of this whole study wasn't just what they collected, but who they invited to the table to help make sense of it all. See, the researchers knew that numbers on a spreadsheet are not enough. Data can tell you what is happening, but it almost never tells you why. And to bridge that gap, they absolutely had to connect the data to real-world, lived experience. So they created something called the Evidence to Action Group, or E2A, and they brought together this incredible mix of people. Just imagine a room where someone with lived experience of meth use is in a conversation with a government policymaker, and a First Nations elder is offering their wisdom to an academic researcher. This is how you make sure the research is actually grounded in reality. And listen, this group wasn't just for show. They were at the core of the entire research process. Right from the start, they helped set the guiding principles for the whole project. They helped guide the analysis, pointing out which things really mattered. They helped interpret the results, giving that crucial why behind the numbers. And, maybe most importantly, they helped figure out how to turn those findings into actual policies that could make a difference on the ground. So, what does this all mean for the future? Well, this combination of big data and community wisdom, it creates a really powerful new model for public health. This right here is the key takeaway. This whole model builds a bridge from raw data to real solutions for the community. It yanks research out of its academic bubble and makes sure that the outcomes are practical, they're culturally sensitive, and they actually address the real needs of the people they're trying to help. Of course, no study is perfect, and the researchers are really transparent about its limitations. Like, for example, the data is specific to the city of Winnipeg, and it only captures people who've actually come into contact with the health system. But being upfront about these things is what builds trust, and it makes the strengths of the study, like that unique paramedic data and the strong community partnerships, even more powerful. So the end product here isn't just some academic paper that's going to sit on a shelf and collect dust. No, it's about creating practical, accessible tools, things like infographics and interactive dashboards that decision makers, frontline workers, and community groups can use to make a real, immediate difference in people's lives. In the end, this study from Manitoba leaves us with a really powerful question, especially in our age of big data and algorithms. It suggests that maybe the best path forward isn't just about having more data, but about having more humanity, about combining rigorous evidence with deep, lived wisdom. And maybe that's the real key to turning information into action that truly matters.